Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Scarborough from Scarborough Family Medicine, and of course, also nurse practitioner Hollie. How are you, Hollie?
I'm great.
Nice
How are you?
to see you.
Nice to see you.
Okay, and everyone, March is Colorectal Cancer Awareness Month. How are you?
I'm good.
Explain to everyone what Colorectal Cancer Month is about.
Well, I think it's bringing awareness that it's time to get that colonoscopy when you hit the age of 50. Unless you have other risk factors, you know, you might want to do it earlier. But age 50 and above, we really want to get the word out. It's time to get that screening colonoscopy. We want to prevent colon cancers.
Okay, now let's just go back a little bit if we can, Dr. Scarborough. Nurse Hollie, let's talk a little bit about previous issues. Now, we mean with family members that have had colon cancer, right?
Right. So genetics, that plays a large role in colorectal cancer, along with age, obesity, and also colon polyps if you've had that on a previous colonoscopy.
Yeah. That's the important thing.
Yes.
I've told you once before when we've chatted that my father died just recently of colon cancer.
Oh,
I wasn't at the age of where I was supposed to have it done.
Right.
And I was worried that insurance wouldn't cover it. There are a lot of factors that go along to having a early diagnosis, right?
That's correct.
And you need to really walk that through. Where do we stand in the state of Georgia when it comes to colon cancer and in America? Once you told us heart health is the #1 cause of death.
Right.
What about colon cancer?
Colon cancer is the second leading cause of cancer deaths. So it's the third most common cancer in the United States.
Okay, let's talk a little bit about, because people at home would like to know, I know they would, are there symptoms that one may have colon cancer?
Well, the symptoms are kind of vague. So, sudden, loss of weight when we're really not trying to lose
Right.
weight. Anemia, people that have a low blood count. They come in and say they're fatigued. We do a routine CBC. They realize that they're anemic. So if we do not have a reason for that, then that's another indication to maybe get that screening colonoscopy.
Okay, let's talk a little bit about the screening, can we?
Yeah. Sure.
What happens?
Well, so you see a specialist like a GI doctor, and they give you a solution that you prepare for the day before, and then you go in and you're given some medicine that puts you to sleep. And most people don't even remember anything that happened during that time.
Yes.
So, and they do your screening, and then you wake up and it's over.
And I have to say, a lot of people think that PrEP liquid
Yes.
is the worst. I have to be honest, I had mine done 2 weeks ago.
Yeah.
I didn't really think anything of it.
Well, good.
You know, all I thought about was, I really don't want everyone seeing what's going down.
Yeah, exactly.
Do you know what I mean?
Right. Well, the PrEP has gotten a lot easier. A lot
Yeah.
of the doctors have changed up the PrEP to make it a little bit more tolerable. So I think the PrEP is probably the worst part of the procedure. The day of the procedure, you're very comfortable, and like Hollie said, you don't remember the procedure itself.
Where do you both stand? Because I know you can get an at-home testing solution or a testing wipe or something.
Yes,
What
the
do you know
Cologuard.
about that?
Well, the Cologuard is for low-risk patients. So if you have a genetic component, or if you've had a history of polyps, if you're over the age of 75, we do not recommend the Cologuard type test.
Over 75?
That is
Okay.
correct, because it's a high risk of false positives.
Really?
So they're actually looking for a genetic part, a defect. They're actually looking for genes that are found in colon cancer.
Right.
So it's pretty specific about that. So it's 92% specific for that. So if it comes back positive, then we do have to follow through with that colonoscopy.
Look,
Right.
all I can say is the best advice to anyone, go and see Dr. Scarborough. They're going to take care of you. They're going to walk you through this, because it is important to take care of your health. Thank you so much. Colon Cancer Awareness Month is this month. Scarborough Family Medicine is up on the screen. Give them a call, everyone. Back after this short break.